Today, we have a total of 559 new cases of COVID-19 in British Columbia, 29 of whom are epidemiologically linked cases, bringing our total number of people with COVID-19 to 77,822. Of the new cases, 132 are people in the Vancouver Coastal Health Region, 278 people are in the Fraser Health Region, 39 are people in Vancouver Island Health, 43 people live in the Interior Health Region, 66 people are in the Northern Health Region, and one is a person who normally resides outside of Canada. We're now up to 4,677 active cases in all health authorities across the province, of whom 238 people are currently in hospital, 69 of whom are in critical care or ICU. We have an additional 7,881 people under active public health monitoring, and 71,753 people have recovered now from COVID-19. In the last 24 hours, we've had a single person who has died from COVID-19, bringing the total number of people we have lost in this province to 1,336. And our condolences, of course, go out to the family of this individual in Vancouver Coastal Health and to their community and care providers. Our thoughts are with you during this very difficult time. We have no new healthcare outbreaks, and the outbreak at the Abbotsford Regional Hospital is now over. That leaves us with 12 active outbreaks in long-term care and assisted living and 5 in acute care units. And that includes 415 residents and 218 staff now involved in outbreaks in long-term care. And if we look at these numbers, today we have had no new cases in long-term care or assisted living in the province, and we had no deaths in long-term care in the last 24 hours. The single person who died in the last 24 hours was in an acute care facility. This really is a reflection of the vaccines that we have had and their use and deployment to long-term care and assisted living across this province. It really is remarkable that the effects of even a single dose, and we saw some of that data presented last week by the BC CDC that has shown the vaccine effectiveness after a single dose in residents of long-term care and in healthcare workers who've received that vaccine is upwards of 80% within 2 to 3 weeks of receiving the vaccine. This is a success that we need to appreciate and celebrate, even as we are preparing now to be able to provide more vaccine to more people in our communities. Since the start of our immunization program, 287,950 doses of COVID-19 vaccine have been administered everywhere in British Columbia. That in itself is an amazing feat. And 58,896 people have received a second dose. Most of those people are seniors and elders in long-term care. Related to this, we have, as we report on, we have a very good monitoring system to ensure that we capture anybody who's had an adverse event after immunization. We've now had 292 AFIs, as we call them, reported related to COVID-19 vaccines. Which equals, and about 19 of these are anaphylaxis or allergic reactions that have been treated in the clinics or in the places where immunization was provided. That is something that we have seen across the world with COVID vaccines and with all vaccines, and we are prepared in our immunization clinics to make sure that we can handle these. We have about 10 in 100,000 doses that have led to these types of reactions. I think it is a moment to reflect as we are starting to receive increased supplies of immunizations over the next coming weeks, that we have delivered all of the vaccines as they've arrived. And it's been challenging in these last few weeks where we've had a very limited supply, but we've been able to use the vaccine that we have had to address some of the urgent outbreaks that were happening in our communities, in our long-term care homes, but also in our acute care facilities. And as we continue to ready our province for these widespread mass vaccination, these mass immunization clinics that we are doing a lot of work to get ready, they will begin in the next few weeks for people based on age as we're starting this. We are moving forward and doing a lot of work behind the scenes to make sure that the systems in our health authorities across the province, we have the tools and the resources to take on this incredible and significant task. And we have not spent any time wasted over the last few weeks making sure that we are putting all of those pieces in place and connecting with communities, connecting with arenas and community centers and schools and places where we will be providing immunization in communities and engaging with communities so that we can be in this together to provide this vaccine. As part of this, I have issued a PHO order to allow a number of health professions and occupations to work in our immunization clinics with appropriate training, of course. So this means we've expanded our pool of immunizers and people who can provide services to include dentists, midwives, pharmacy technicians, paramedics, retired nurses, and a number of other professions. So we are very excited to be able to have the workforce that we are going to need over the next 6 months to ensure that we can get vaccine into as many people as want it in this province as efficiently as possible. We also need new systems to manage this process. As we have said from the very beginning, it's incredibly important that we have the ability to know exactly what lot of which vaccine goes into everybody's arm. This is for individuals so that you know which vaccine you got when the second dose comes up, but it's also a really important part of our understanding of safety monitoring for each vaccine. And as more vaccines come online, as we expect them to in the next few weeks, this will become even more critically important. But also, we want to make sure that we have a seamless ability for people to register, to book their appointments, to get their immunization, to have that recorded in our central provincial registry so that it's available to you, to your healthcare providers in the future, and also to be scheduled for your second dose when it comes up. This is important. Without a doubt, there's going to be some hiccups and some bumps, but we are working hard to make sure that we can make it as seamless as possible for everybody, starting with the people who are most at risk. But it is important to know that everybody over age 18 right now who are eligible for vaccines will have access. Nobody will be left behind. We will be finding you from various different ways, whether it's reaching out, as we are starting to do in the coming weeks, through understanding people from our MSP lists and through specialty clinics, through family physicians and others. In parallel with more vaccine increasingly available, we are now turning our focus to people over age 80 in our communities around the province. These seniors and elders will receive vaccine information in the next 2 weeks. So please be patient. We have not forgotten you. These plans are in place, and we will be reaching out to you in the coming days and weeks. And we'll be sharing more details, as Minister Dix indicated, on Monday when we have more of the exact details for everybody worked out in the coming days. As part of our current efforts, however, to manage this pandemic as we're moving into this very exciting and positive phase, we are paying close attention to what we're calling variants of concern, and I know that has been an issue, particularly in the last couple of weeks. And we need to understand the effects that these viruses, these variants, have on our transmission, on events in our communities here. And over the past 2 weeks, since the beginning of February, when we put in place extensions of the orders that we had in place, part of the reason to do that was because we did not know how many of these variants we were seeing, what proportion of our cases were being affected, how much transmission we're seeing in our community. So that has been a focus over the last few weeks, to understand better what the impact is or will be or could be from these variants of concern. We have been monitoring closely. We've been increasing our screening. Initially, we were able to do whole genome sequencing on a small proportion of cases over time, about 5%. And our labs have been working full time, and they've developed what we call a screening test. So when we do the initial PCR test, it detects the RNA from the virus, but we need to do another test. It's called a SNP, or single nucleotide protein, that targets specific variants, parts of the genome that we're concerned about that are associated with these variants of concern. And the main one we're looking at is the N501Y, and you may have seen that in some of the scientific documents. And that is the piece that we believe is associated with the mutation of the spike protein that leads to increased transmissibility. So that's one of the pieces that we're most concerned about. So we now have the ability to screen about 70% of our positive tests every day for this variant, for this mutation, and that allows us to screen out which ones are most likely to be a variant of concern. We did this in what we call a point prevalence study, and I mentioned this last week, but just to reiterate, on 5 days at the beginning of this month, we screened every single test that was done. It was about that was positive, so it was about 3,099 of them with this special SNP, and it picked up 30 that looked like they were a variant of concern. And then we did whole genome sequencing on those. Whole genome sequencing is a bit more labor-intensive process, and we have limited capacity of about 500 to 700 a week, and though we're increasing that as well. So being able to screen out ones that don't have any of the worrisome mutations allows us to focus on the ones that are most risky. So that screening test is done right after the PCR test turns positive. So we get that information much more quickly, within a day. And now that is being provided to the public health contact tracing teams in our health authorities, so they are able to more rapidly follow up with people who have what might be a variant of concern. And then we do whole genome sequencing on those. Of the ones that we did a couple of weeks ago, the 3,099, 30 of them screened positive with this screening test. And of those, 3 turned out to be true variants of concern. 2 of them were the UK, the B117, and 1 was the B1351 associated with South Africa. So that, 131 associated with South Africa. This is some of the things that have been going on in the background as we try to understand the impact that these new variants that we have seen, the impact that they have had in countries, other places in the world, and in other parts of Canada. So this past weekend, as we all know, there were a number that were identified, but they were identified over a period of weeks. So this is still part of our catching up on understanding which cases are associated with these variants of concern. And the cases were identified over the weekend were in a batch that covered several weeks. As we had said before, because we are doing extra testing on school-age children particularly, even though they were reported at the same time. All of these cases are followed up by all health authorities. The majority of them have been in the Lower Mainland, in both Vancouver Coastal and particularly in Fraser Health. And we are paying extra attention so that we better understand where and if these are spreading, particularly in environments that are so important like our school systems. So we're not doing things differently, but we are doing paying attention so that we better understand the impact that these are having in our communities around the province. We know that the school exposure, we're doing extra testing. We started that with the concern that we had earlier in Garibaldi, where no other people in the cohort tested positive. And I know Fraser Health is working in the last few days. The initial tests came back. So far, I understand that there has been the potential for one rapid test to be positive, and that one is being confirmed. And Fraser Health will be having more details about these in the coming days. So really, this is important for us to understand where we are in the trajectory and what the potential is for increasing cases. It is concerning that we are seeing an increase in percent positivity and our 7-day rolling average of cases in particularly, again, in the Lower Mainland. But viruses do mutate and do change, and this is important for us to monitor. We saw this early on, and we can continue to see it today. But for most of us, public health is paying attention with the work that we do in contact tracing and making sure that we are connecting with close contacts and doing extra testing, as we have been doing all along. However, right now, for the rest of us, it means that we have to continue to pay attention to the very same things that have gotten us this far in this pandemic. And that paying attention to staying home if we're not feeling well, to getting tested immediately if we have concerns or if we've been in contact with somebody who has concerns. Making sure that we wash our hands regularly, cover our mouth when we cough, wear masks when we're in indoor public spaces, and following our COVID safety plans, whether it's at work, at school, or whether you're in the healthcare system. We are holding steady in this past month. This uptick that we've seen in the last few days is one that we are managing as aggressively as we can to understand better where we are. This is in contrast and balanced with the positive news that we have about how effective these vaccines that we have are working in our long-term care homes, in our healthcare system. And we're learning about the impact that these variants of concern can have. But we know what to do to manage these, and we can and will do it. We are in a period of what I'm calling vaccine hope and pandemic reality. And our focus has to be to hold steady, to support each other to get through this part of our marathon, our storm, even as it becomes more and more challenging. We know that there's more vaccine that's coming. We know that we're ramping up and we're ready to go to protect more people in our communities. And we know that we have the tools and know what to do to keep this virus in check. And no matter where we may be or what we're doing, we can get through this by being kind to each other, by remaining calm and keeping safe.